Yes, how many people in the audience have Lyme? Okay, how many might have just gotten diagnosed? Okay, so this is more people who are familiar with Lyme. Okay, sometimes I get people who are just finding out about Lyme, so if I'm starting by going into some elementary things about Lyme, just tell me and I'll just progress or, ask some questions or anything. Okay, so objectives, I want to educate people about Lyme disease, to go over the scope of the problem, to help you understand what you need to know and why, to introduce at the end of the talk the concept of integrative medicine and how I apply that to treatment of someone with Lyme disease. That's just my training and stuff. So overview, I'll talk about epidemiology, I'll talk about the manifestations of Lyme, the diagnostics, co-infections, little thing on Lyme in children, chronic Lyme, and then integrated treatment of Lyme. Now, all of you know that it's an arthroborne vector-borne disease caused by the bite of a tick, although they're finding that a lot of the co-infections and Lyme itself can be in other vectors, mosquitoes and things like that. Obviously, Borrelia causes Lyme, Ehrlichia, Bartonella, Mycoplasma is in Lyme disease, Babesia, and viruses. And recently there was a whole thing about Powassan virus that went in the news and went out of the news, and that often happens with Lyme disease, like a flash, this is really serious, and then all of a sudden it's gone. And the CDC just recently went from 30,000 a year to now 300,000 a year, so hopefully they're getting the seriousness of it. This is basically an older slide, but it just shows the distribution, heavy in the Northeast, Midwest. California is much more than that now. And this is the 2-year cycle of a tick. First, the eggs go to a larva, and then you have a nymph, which is very small, which is an avaricious feeder, and then it goes into the adult. I don't have here anything about the the Lone Star tick, which is a real predator. So Lyme, just gets blown in the wind or hits you from grass or on a tree, but the Lone Star tick actually comes at you, and it used to be in the southwest and in the west, and now it's really coming into the east. So it's increased incident because of the increased deer population and decreased predators and of mice and other rodents. And the reservoir is deer, mice, and birds also. It's the most common tick-borne disease, Lyme, in the United States, North America, and Europe. And it's the fastest growing infectious disease. And as I said, the CDC 2013 study upped their estimate of Lyme. And Dutchess County, where my practice, where I started, and I have a satellite up here, is really one of the epicenters. And I first got into Lyme about 30 years ago when I was treating a lot of chronic fatigue and immune problems. And I started seeing people who came in and had symptoms of Lyme and arthritis and immune problems, and they had negative testing. And whereas when I went into integrative medicine over 30 years ago, I took people, mainly kids. I did a lot of nutrition in kids and allergy testing, and I was antibiotic adverse. And then when I got into Lyme, I found that people needed higher doses and longer doses of antibiotics. So I kind of have been both sides of the fence. This is a picture of a tick. This is another one, mainly on the jaws. This is an adult tick, the size. And this is, the nymph is on the proximal crease right there. It's really small. And this is an underfed tick, and this is an engorged tick. And recently I had someone who came in and said to me, could they ask about a friend? And they said, well, a 12-year-old got bit by a tick. He had a tick on. He went to the pediatrician to take it out, and the pediatrician did a Lyme test, and it was positive. And so we put him on 200 milligrams of doxycycline. So I just said there's a lot of errors in that. First of all, number one, when you have a tick bite, and you do a blood test, that is not telling you anything about the time that the tick is biting you, because it takes minimum of 4 weeks, and I've had people who haven't been antibody positive for years. So that blood test only is relevant to tell what's been in the past. So if he had positive Lyme, he may have had Lyme and now he has a tick bite. Then if you have a tick bite and it's on longer than a certain amount of time, which I go different from the CDC. CDC says 24 to 36 hours. I've seen people get Lyme from as early as 6 hours. So I usually use prophylaxis. And so in this case, it's from an article from my old medical school, and a guy named Feder, and somehow they just made up, because the article was full, 200 milligrams with a bite will stop Lyme disease. Now, it's really hard. How did they determine that when the Lyme testing is not very effective and only like ELISA would be 49% sensitive? So that's a good example of a lot of times physicians out in the field who aren't familiar with Lyme just totally don't have the right information. This is a bullseye rash. This is another one which doesn't have a clearing. Now, they don't always have to look like a circle. They can be in a crease. They could be oblong. So you just, have to always think of that in this area if there's a rash like that. Another one. And this didn't come out too well, but that's... So EM, or erythema migrans, is the rash that you get after a bite. It turns up from 3 days to a month. I mean, so if you get somebody who comes in with a tick and all of a sudden there's a nickel or even a quarter redness, that's probably from the irritation cellulitis if it's really early. Then, of course, the closer you get to 3 days, that's when the EM rash would start. So it's important to differentiate between irritation, reaction, and EM rash, because the EM rash is diagnostic for Lyme disease. So that's another thing that happens is someone gets an EM rash and they go to the ER and the ER doc says, well, we'll wait to see if you have symptoms. No, if you have an EM rash, I give 6 weeks of antibiotics for sure. And so things start, tick bites in March, May, peak in the summer, and then go down in August or October if as it gets colder, but lately I think they're extending the season more and more. And when you have acute Lyme, it goes to the skin, like I said. It goes to the joints, nervous system, cardiovascular mainly. It can end up in a lot of diseases. Lyme could be in the gut. I've seen people present with sinus that's Lyme. So it's not only in the major places. Associated symptoms when someone has Lyme, and then a couple of days later they can have either a constellation of symptoms or they can have single symptoms. They can have myalgia, fever, chills, sweats, fatigue, stiff neck, numbness and tingling, depression. I had a friend of mine who was in Ternio about probably 15 years ago. His wife was Swedish. She was in perfect health. And she came in, he said, could you see her? Yeah, she's depressed. She came in, she's depressed. I went over everything. There was nothing depressing her. No other medical problems, so I did a whole workup. Turns out she was positive for Lyme, and when I treated her, depression cleared. She had no joint pain, no muscle pain, no headache, no stiff neck. So, so I'm saying that you have to think of Lyme, but on the other hand, it's my job to not think of myself as everything in front of me is Lyme. And I always tell people when I talk the story of my wife, we have a Maltese, and the dog was on the couch, not urinating, not defecating, not eating, and she said, and she knows my practice, and she said, what's wrong with the dog? Telling us Lyme. You think you're insane. She says, you have off this morning, go to the vet. So I said, okay, I'll take it to the vet. So I go there, and the vet says, oh, your wife did a Lyme test 4 months ago. I said, just do it, Came back positive. You think my wife said anything when I got home? And you can get cardiac symptoms, you get sleep disturbance, decreased concentration, cranial nerves, and it doesn't have to be the classic that's in the literature of bilateral Bell's. That's pathognomonic for Lyme disease, but I've seen plenty of people who have unilateral Bell's palsy or another cranial nerve. And other symptoms in chronicity is ocular symptoms, cognitive dysfunction. Lyme can stimulate the immune system. It can either depress it or it can, upregulate it, so you get autoimmune phenomena, arthralgias, arthritis, fibromyalgia. A lot of times Lyme can cause the symptoms of fatigue and fibromyalgia. And if you go to a rheumatologist, he might diagnose you with fibromyalgia or chronic fatigue and say your Lyme test is negative. But I'll get into that, because a negative Lyme isn't literally you don't have Lyme, it's just a negative test. And Lyme disease in children can be very subtle, and usually the best person to know about that is the mom. If the mom comes in and says, he's not acting normal, he's loved school, now he's school phobic, or he's doing poorly in school, or he's got mood disturbances, or fatigue, or he's limping, and the pediatrician said it's growing pains. You just have to always have that suspicion, because you don't want to miss that in children. Now, I got a couple of these slides from friend Borascano, and I really liked them because, like the woman was talking about Lyme and how the climate is, there's people like me and ILADs who say that, Lyme is very complex and it can become chronic and cause a lot of different problems. And then there's the Infectious Disease Society that says 4 weeks of antibiotics and there's no such thing as chronic Lyme. So I was reading this, and it was discovered in '75 by a resident in rheumatology, Dr. Steer, and what he found is a cluster of arthritis in Lyme, Connecticut, that he diagnosed arthritis and maybe autoimmune. And then in 1982, Burdorfei discovered that Lyme is caused by a bacteria. So when Steer found that out, he gave a trial of antibiotics, which didn't clear all the symptoms. And what he did is he redefined the field. What he said was the major symptoms, and when I read this, I kind of said, wow, this is really clear. Bell's palsy, cardiac problems, and arthritis. Arthritis is swelling of the joint. And the minor symptoms are fatigue, arthralgia, headache, neuropathy, and cognitive dysfunction. And what he redefined success as the elimination of the major symptoms. So in other words, what he was saying is, if someone has cognitive dysfunction, has arthralgia, just pain in the joints, their Lyme should be cured. They shouldn't have that. So, that's just making up what you want to be positive for Lyme, and then saying you're going to treat that and everything else is out of the circle. So I thought that was really interesting to me. Now, one of the things I like to always present is in diagnosis. Now, I said before, a negative Lyme test doesn't mean that you don't have Lyme. It's just one of the things that you would say, okay, do I do more Lyme tests or do I do co-infections? So there's a pyramid of diagnosis. First, we do an ELISA, which is a general test where they mash up all the antigens on the Borrelia and they test for positive, reaction to that. And the thing is, some institutions do an ELISA, and if that's negative, they won't do a Western blot. Now, the ELISA is about 49% sensitive, which means it's like flipping a coin. So I always get the Western blot. I never do an ELISA reflex, because I want to see the Western blot. The Western blot is a more thorough look at all the antibodies that could be up. That can still be negative because the Lyme suppresses the immune system, and people who don't have a good immune system, they may not make the antibodies. Then the next test is what they call a urinary antigen capture, where you put someone on 5 days of multiple antibiotics, and then you get a urine on the 2nd, 4th, and 6th day, and you send it in and you test for the Lyme. Now, this test is good in 2 ways. If you're on the fence, does someone have Lyme, you're giving a short course of antibiotics, and then you want to see if they're better or if they're worse, because if antibiotics make Lyme worse, it could be what we call a Herxheimer reaction. So you just have to, have them take a journal and look into that. And then, of course, you get the test back. Then the next thing under is something called the C6 Lyme peptide, which is a more quantitative ELISA. And it's good. It's one of the good things to have. If it's positive, you can actually use it quantitatively. So in other words, if someone's positive the normal is up to 0.9 or 1. And if you measure it at 7 or 8, you can know that that's positive, and it's going to go down over about a year and a half. So if you see them in 6 months, it could be 4, then it could be 2 in a year. The good thing about that is if you get it down and the person's better, if they get Lyme back, you can repeat it, and it may go up to 5 or 6, and then that says, okay, the C6 went up, you probably have a recurrence of your Lyme. One down is a PCR, which is testing for the genetic material of the Lyme. So that's good because it's not the antibody. Antibodies are made by us in response to the Lyme bacteria. The PCR is the genetic pieces of the bacteria. So if you have a positive Lyme, that's good. Negative Lyme, that doesn't mean it's negative. Again, negative Lyme just means they didn't find it. You may have to do 3 or 4 PCRs, and it's expensive, so that's a little glitch. If it's positive, then you can hang your hat on it. Now, then the line that I have there is seropositive. That means your test is positive, and that supports your clinical diagnosis. And underneath, if you have seronegative, which means the testing is negative, then what you have is co-infection. So maybe the symptoms are negative Lyme, but co-infection. And I had my daughter had serious problems with Lyme. She's now better. But I did testing with her before she ended up in my old hospital. And she was negative with Lyme, but positive with Ehrlichia and Babesia. So when I was down there, I showed them the testing from a place called IGeneX. First of all, they don't like that and stuff. But then I really realized that if a patient is in the hospital and has the doctors, they can be buffaloed all the time. You know, I'm a physician, so I said, look, this is proof of a tick bite. So, and I think she has cranial, nerve things going on. It's Lyme disease. And finally, they said, yeah, you're right, we'll put her on IV antibiotics and stuff. But it's amazing how resistant they could be. The next thing underneath the pyramid is ECM rash, which is pathognomonic. That's, you treat it. And then the bottom base is clinical impression. And so you start with the clinical impression, then you get all these tests. You don't get a negative test and then just say it's not Lyme if you have clinical impression. Now your clinical impression could be, Lyme, maybe fibromyalgia, maybe other things, but you have to go through those and then get to Lyme if it's pertinent. Okay, then I put just one slide on the immune picture, which is the antibodies. Now, because I said that an antibody test could be negative, the thing about antibodies is they're produced by us, and the antigen is part of the bacteria. So when those two come together and they form immune complexes, which means that you have Lyme and your antibodies are fighting it, but if there's no antibody left in the blood, because the laboratory measures excess, then you have a negative test, but you could still have the complex. So sooner or later, they're going to get a test for immune complexes, which would be much more diagnostic for Lyme disease. Does everybody understand that? Then another thing that always comes up, and people hear it, IgM and IgG. Now, IgM is early production of antibody, which normally in the textbook is 2 to 3 months, and then it will convert to gamma globulin, IgG. Unfortunately, I don't think Lyme follows the book as do a lot of diseases. I see people who have IgM up, and to me, and other colleagues of mine, that means the body's being stimulated almost anew and forming IgM, because it's almost like, well, that shouldn't be, so we're going to say that's a false positive and throw it out. I always like to work with the physiology that's happening. It's like, why is there IgM? You can't just say it's a false positive and it doesn't mean anything because it doesn't fit the book. So everybody asks, why is Lyme a difficult diagnosis? Well, number one, less than 50% of people get a rash. Less than 50% notice a tick bite. The antibody testing is poor, like I just said. The antibody testing does not distinguish between past and present except for an acute IgE. So if you get an IgE Western blot, and that's very positive, and it's 6 weeks or 8 weeks from a bite, or it's around symptoms starting, then that pretty much dates that that's early Lyme. Now, another glitch that you have to understand is when doctors look at the Western blot, they'll say, okay, it has to be 5